Hello everyone, welcome back to our channel. So this is Guntur Medical College, Department of Anatomy. In this video, we will see the gluteal region. Here we have reflected the skin, superficial fascia and deep fascia. So we have exposed the muscles. First we will see the superficial muscles. The broad muscle which you are seeing is this gluteus maximus. It's a broad muscle which takes origin from the dorsal surface of the sacrum and also from the gluteal surface of the ilium behind the posterior gluteal line, and also from the coccyx and sacrotuberous ligament. If you see the insertion of this gluteus maximus, it is inserted into the iliotibial tract. 3/4 are inserted into the iliotibial tract. They are all the superficial fibers and the upper deep fibers, they are inserted into the iliotibial tract. Lower deep fibers, they are inserted into the gluteal tuberosity. This muscle is supplied by the superior gluteal nerve, and this muscle is supplied by the inferior gluteal nerve, and its main action is the extension of the hip joint. The students can remember it passes posterior to the hip joint, so it causes extension of the hip joint. So we have now cut through the gluteus maximus muscle. Now you are seeing the structures underneath the gluteus maximus in the gluteal region. We will now see the second muscle, or you are seeing here this is the second muscle. It is the gluteus medius. Are you seeing this muscle? It's a fan-shaped muscle taking origin from the gluteal surface of the ilium between the inferior gluteal line and the anterior gluteal line. And you can nicely appreciate it is inserted into this is the greater trochanter, and it is inserted into the anterolateral aspect of the greater trochanter, and this is innervated by the superior gluteal nerve. If you see this action, this gluteus medius being inserted to the superolateral aspect of the greater trochanter causes abduction of the hip joint. And the student should understand this gluteus medius and minimus, they cause abduction of the hip joint, and they are very important. For example, if you take every step in the walking, we are slightly abducting the hip joint, and for every moment of this abduction, this medius and minimus should come and stabilize the bony pelvis. Now we have cut the gluteus medius. Now we can see this is the gluteus minimus muscle. Again, this is also the broad fan-shaped muscle which takes origin between the anterior and the posterior gluteal line. This gluteus minimus is also inserted to the greater trochanter. You can nicely appreciate these two muscles are supplied by this superior gluteal nerve. So this is the superior gluteal nerve cut in, and this is the superior gluteal artery. Both structures pass from the upper border of the piriformis muscle. So we have covered three muscles, gluteus maximus, medius and minimus, and the one more superficial muscle is the tensor fascia lata, which will be inserted to the this is the tensor fascia lata, which is most anterior in the gluteal region, which is inserted to the tensor fascia iliotibial tract. So this is the tensor fascia lata inserted to the iliotibial tract, and this is the gluteus maximus inserted to the iliotibial tract. Iliotibial tract may be asked as the short notes for you. Now we have reflected the maximus, medius and minimus. Now you are seeing the deepermost muscles. First deepermost muscle what you are seeing is this piriformis. Are you saying this is the piriformis muscle? This is like a pear shaped, so it is called as piriformis. It takes origin from the sacrum, from the pelvic surface, comes via this is the greater sciatic foramen. What I am palpating here is this greater sciatic foramen. So this piriformis comes through the greater sciatic foramen and inserted to the upper part of the greater trochanter. So this is the key muscle of the gluteal region, because so many nerves and arteries pass from the upper border and the lower border of the piriformis. So from the upper border we have seen the superior gluteal nerve and artery. From the lower border we will see the most important nerve. From the lower border of this piriformis is the sciatic nerve, which is the thickest nerve of the body. So this is the sciatic nerve. Other structures from medial to lateral, you can see so many structures are here. So in the medial most structures will be called as the pin structures. They are the pudendal nerve, internal pudendal artery, and nerve to obturator internus. So these pudendal pin structures pass via from greater sciatic foramen, then again enter through the lesser sciatic foramen to enter the perineum. Otherwise, these structures come for while to the gluteal region and enter the perineum. So from the pelvis to the perineum, this is the pathway for the pin structures. If you see this, all the sciatic nerve also, this gluteal region is the pathway for the sciatic nerve to enter the back of the thigh. But apart from that, if you see the superior gluteal nerve and superior gluteal artery, inferior gluteal nerve and inferior gluteal artery, they are the nerves and vessels of the gluteal region. The other structures are passing via the gluteal region. So inferior gluteal nerve supplies, so these are the inferior gluteal nerve and the inferior gluteal artery. Now we will see the other structures. Just beneath this piriformis, you can see this. This is these two are the superior gamellae and the inferior gamellae. Gamellae means in the Latin twins. So this is superior gamellae and this is the inferior gamellae, and this is the obturator internus tendon. You can nicely appreciate obturator internus tendon. These three structures are inserted to the medial surface of the greater trochanter. Superior gemellus takes origin from the ischial spine, and this inferior gemellus takes origin from the ischial tuberosity. If you see the nerve supply of the superior gemellus and the obturator internus, it is the nerve to obturator internus. If you see the inferior gemellus and the deepermost next muscle is this quadratus femoris. Now you can see this is quadratus femoris. Yes, this you can see it is quadrangular in shape. Quadratus femoris again takes origin from the ischial tuberosity and it is attached to the femur. So these two are supplied by the nerve to quadratus femoris, and this gemellae and internus, they are supplied by the nerve to obturator internus. So these are the main structures in the gluteal region. I hope I have covered all the muscles. You have understood. This is the gluteus maximus. This is the medius, gluteus medius muscle. Underneath the medius, minimus muscle, and these are the superior gluteal nerve and the artery. Piriformis muscle. These are the tricipital tendon, or the otherwise called as tricipital tendon, tendon of obturator internus, superior gemellus and inferior gemellus, and this is the quadratus femoris. And we have seen superior gluteal nerve and artery in relation to the upper border of piriformis, in relation to the lower border of piriformis, pin structures, then inferior gluteal nerve and artery, also the posterior cutaneous nerve of the thigh, nerve to obturator internus, nerve to quadratus femoris. So many structures are related to the lower border of the piriformis. That's why it is called as the key muscle of the gluteal region. So with the next video in the lower lip, we will see in the next. Thank you.